Leuprolide, 6-month, syringe is a medication used to treat advanced prostate cancer. It is not a cure, but it works by reducing the amount of testosterone that the body makes. This helps to slow or stop the growth of cancer cells and can also help relieve symptoms such as painful or difficult urination. It is important to talk to your doctor about the risks and benefits of this treatment. The recommended dosage and timing for this medication should be determined by your doctor based on your individual condition. Before starting your treatment with Leuprolide, 6-month, syringe, make sure to read the patient information leaflet from your pharmacist. This medication is given by injection under the skin as directed by your doctor, usually once every 6 months. It slowly releases the medication into your blood over a 6-month period. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the product package. Before injecting each dose, remember to clean the injection site with rubbing alcohol and change the injection site each time to lessen injury under the skin. Remember to use this medication regularly to get the most benefit from it, and mark your calendar to keep track of when to receive the next dose. During the first few weeks of treatment, your hormone levels will actually go up before they go down, which is a normal response to this medication. If you have prostate cancer that has spread to the spine or caused urinary blockage, make sure to closely monitor any symptoms and contact your doctor if you experience any unusual pain or weakness. If you are using the Leuprolide 6-month syringe, some common side effects may include hot flashes, increased sweating, night sweats, tiredness, swelling of the ankles/feet, increased urination at night, dizziness, or mild burning/pain/bruising at the injection site. Rare side effects may include shrinking of the testicles, breast tenderness/swelling, or reduced sexual interest/ability due to lowered testosterone levels. It's important to remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. However, if you experience any serious side effects such as new/worsening bone pain, easily broken bones, increased thirst/urination, mental/mood changes, symptoms of a heart attack or stroke, seizures, fast/irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction, it's important to seek medical help right away. If you experience any other effects not listed, be sure to contact your doctor or pharmacist. Before starting Leuprolide treatment, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication can potentially contain inactive ingredients that may cause allergic reactions or other issues, so be sure to talk to your pharmacist about any concerns. Inform your doctor or pharmacist about your medical history, especially if you have conditions such as diabetes, heart disease, high cholesterol, or mental/mood problems. Additionally, let them know if you have osteoporosis or if you have any risk factors for developing osteoporosis, such as long-term alcohol use or smoking. Leuprolide may also affect your heart rhythm, so it's crucial to inform your doctor of any heart problems you may have or any medications you are currently taking that could impact your heart rhythm. Additionally, low levels of potassium or magnesium in your blood may increase the risk of heart rhythm issues, so be sure to discuss this with your doctor as well. This medication can cause dizziness, so it's important to avoid alcohol or marijuana use that could further intensify this effect. It's also crucial to inform your doctor about all the products you use before undergoing any surgery. If you are an older adult, you may be more sensitive to the side effects of this medication, particularly heart rhythm issues. This medication can also affect fertility in males, so be sure to discuss this with your doctor if needed. Leuprolide must not be used during pregnancy, as it may harm an unborn baby. It's essential to use reliable forms of non-hormonal birth control while using this medication and to consult your doctor immediately if you suspect you may be pregnant. Additionally, breastfeeding is not recommended while using this medication, so be sure to consult your doctor before breastfeeding. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs and herbal products. Do not make any changes to your medication dosage without your doctor's approval. It's also important to note that this medication may interfere with certain lab tests, which could potentially cause false test results. Make sure that the lab personnel and all your doctors are aware that you are using this drug. If you suspect an overdose or serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical assistance by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. It's important not to share this medication with anyone else. While taking Leuprolide, 6-month, syringe, you may need to undergo various lab and medical tests to monitor your condition, such as blood testosterone level, PSA blood test, and blood glucose. It's crucial to attend all medical and lab appointments and consult your doctor for more information about these tests and your treatment plan. Make sure to take each dose of Leuprolide, 6-month, syringe as prescribed by your doctor. If you happen to miss a dose, it's important to consult your doctor or pharmacist immediately for a new dosing schedule. It's crucial not to take a double dose to make up for the missed one. Taking the medication as directed will help you get the most benefit from it. This medication is usually injected into the muscle by a healthcare professional, typically once every 6 months. It's important to take it at the same time each day to help you remember. The optimal timing for taking this medication will depend on your individual schedule and lifestyle, so consult with your healthcare provider for the best timing for you. When it comes to storing your Leuprolide, 6-month, syringe, it's important to follow the specific instructions provided by the brand you have. Be sure to keep all medications out of reach of children and pets. When it comes to getting rid of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard it when it's expired or you no longer need it. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.